All right, class, let's get into lecture 5, which is all about infrastructure. It's infrastructure of physical activity at the local, state, federal, now worldwide programs. Okay, so I'm going to share my screen so we can look at our lecture and understand a little bit more about what we're discussing when we're talking about infrastructure. So, one thing to know about this definition is it refers to the built environment, but it also refers to the programs in place to support people becoming physically active. And so, we want to understand the different programs that are available that help improve health, well-being, fitness, etc. We want to understand how infrastructure can help to improve our activity in urban and rural areas, and then look at some various health organizations and what they can do for you. So first is the WHO, the World Health Organization. So one thing to know about the World Health Organization, it's an agency of United Nations. It's like 119 nations who've come together to help with the world's response to health emergencies. They did so much for us during the COVID-19 pandemic, doing lots of research, epidemiology studies, looking at prevention, looking at how we can stay healthy and overcome all of these different diseases that we come in contact with. And so they're big at disease prevention and expanding healthcare. They also have a site where they look at physical inactivity, and they have found it is the fourth leading risk factor for global mortality, death. So causing 6% of deaths worldwide. But if you think about it, it's not just the physical inactivity that has caused the death. It's what comes with being sedentary. We've discussed non-communicable diseases, those that are not transmitted, those that are due to lifestyle behaviors, such as being sedentary. And normally, if someone's sedentary, they usually also have a poor diet and may also engage in substance use and abuse, such as alcohol and drug use. And so all of that together has led to the 6% of deaths worldwide. So it's a risk factor. 1 in 4 adults and 81% of adolescents do not engage in enough physical activity. That 1 in 4 adults we talked about in the last lecture, and how that's very common among like college age students, very common among, like we said, people who live in Lubbock or live in Texas. It's about that 25% of adults engage in regular exercise, and 80 or don't engage. And then the 81% of adolescents as well. So, what actions are they taking to combat this physical inactivity epidemic? They are looking at policy, creating new policies to help promote physical activity, and helping to ensure access to sports, help promote walking and cycling, making it more accessible for people to walk and cycle to work and to places around their community, and then creating partnerships across different sectors, countries, counties, states, counties, all that, to improve our physical activity levels. So their goal is to reduce physical activity, so by 10% in 2025, by 15% in 2030. Again, we're just trying to get people active because of all of the health benefits, and how it can impact our life for the better. So some objectives they have, like I said, they are looking at developing different global policies with physical activity, supporting countries to develop those policies, advocacy to raise awareness about the benefits. Again, this is just increasing your knowledge about physical activity and how important it is. So becoming more educated about how to develop a physical activity program, what it can do for you health-wise. And then also looking at monitoring, reporting progress on the implementation of this global action plan of physical activity. And then again, making progress towards that 15% reduction in the prevalence of physical inactivity. And so the WHO is really working, trying to improve the world's physical activity levels. CDC is next. So we know CDC is based in Atlanta, Georgia, and they're the nation's leading science-based, data-driven service organization that protects the public's health. CDC also was a huge response, or had a huge response during the COVID-19 pandemic. when you go to their website, they have a link for almost every single health awareness topic that you can even think of, from exercise, multiple different types of exercise, to nutrition, to substance use and abuse, to car seat safety, to sunburn, to skin health, insects, bites, any type of illness, disease. They have everything. So I suggest checking out the CDC's website to look up any, health related questions you have. I think they're a really great resource. They have these fact sheets. And so that's where I get a lot of my physical activity statistics, these infographics to educate people on health benefits and guidelines, recommendations on how to meet physical activity levels. And so what are they actually doing here? They have this initiative, Active People, Healthy Nation, and very similar to what the WHO is doing, just trying to increase physical activity levels, reduce sedentary behavior, and to improve overall health of the nation. And so that's what this program is trying to do. So their strategies is they're trying to help with community design. If we can redesign communities to where there's more sidewalks, there's more green spaces, there's more places for people to safely get to and from work, to and from school, we can increase activity levels. Inclusive access to places, so making it just more inclusive, maybe for people who live out in rural areas or low income areas, to where they can safely get to certain places that provide space for exercise. Youth and school programs, so implementing increased recess time, making sure that the recess time is actually active recess time and not just sitting. Maybe increasing the time that these programs have their after school activity programs or in school recess activities. Community ride campaigns. So these campaigns, based in different communities, cities, states, to, bring people in, join together, become more active, play a sport, do an activity. Social individual support groups, and then different prompts to encourage physical activity. A prompt would be just something that just like you see and it like motivates you, or you think about something and it's like, oh man, maybe I should take the stairs today based on how many steps I can get in or how many calories I'll burn walking up these stairs. Or different prompts like, if you walk this far, like you've almost walked like a quarter of a mile, and like that's more like less than anyone does, just certain things that like they make you think and encourage you to be more active. I like this one a lot because I think lots of different cities and communities in Texas, especially out here in Lubbock, Texas, we need more infrastructure that allows people to be active. They have Texas Tech, and Lubbock has done a really great job at trying to build more parks and green spaces. They've built splash pads that my children like to go play at. They've created sidewalks on campus, or bike lanes on campus, and they've tried to expand those bike lanes outside of campus. But this Park Trail Greenway Infrastructure Intervention is put up by the U.S. Department of Health and Human Services, and just trying to increase physical activity and allow more inclusive areas for the community to have a safe place to be active. So walking, hiking trails, cycling that go all across urban, suburban, and rural areas, which again is just amazing. And if we can get this implementation into like all the different communities and cities and states, I think it can really improve the opportunity for us to be active. So some other programs I'll go through is Silver Sneakers, which is for seniors 65 plus, and there are over 1,500 locations across the country, which is so, so awesome that these older adults can join a community of other people their age who are in the same like lifestyle state, where maybe they've lost a spouse, they've lost friends, their family can't take care of them, or they need a place to go and be part of something. Silver Sneakers allows them to engage in exercise appropriate for, their activity level, their age, and is again a place just to be active. So I think this is a really great national program. Another is Exercise is Medicine on Campus, which is Texas Tech is partnering with ACSM, who's putting on this Exercise is Medicine on Campus to really target students and to help students become more knowledgeable about the importance of exercise, understand exercise guidelines, how to create their own exercise program, basically giving them the tools that they need to be physically active and improve their physical activity habits. They also work with university healthcare providers and then set them up with fitness specialists. So again, just another really great resource that is targeted towards young adults who are maybe living on their own by the first time and they've developed some poor, exercise habits. And we want to help them experience like a more positive, active, healthy campus culture. And so again, Exercise Medicine by ACSM is a really great program that I think most campuses should undertake and get their students access to. Healthy People 2030 is another program that just focuses on attaining high quality, long lives, free of preventable diseases and injury, illness, all the things that help to result or to reduce premature death. And so they work with promoting quality of life through all the different ways, and they have lots of different objectives. And so here's some objectives that they have. So basically trying to increase the amount of adults who are physically active, increase the adolescents who are physically active, aerobic and strength training guidelines. They're also trying to increase the proportion of schools that require daily physical activity and PE. They are working to help with school elementary recess programs, making it longer and making it actually more active time. They're trying to reduce screen time. You can see some other things that they're working with. They're trying to increase licensing regulations for physical activity in childcare, which I think is so important since I have children in childcare and daycare, that they should have a certain, amount of time where they are physically active. Some other ones is increased proportion of physician office visits that includes counseling on physical activity. Excuse me. And then increasing employer-based exercise programs, which again, I think is also really cool, is this worksite wellness initiative where we're getting employees active through like incentives, which is a whole other topic that we'll probably get into a little bit later. Also increasing proportion of trips made by walking and biking. Obviously, you have to have the infrastructure in your community and city in order to walk or bike to school. But again, something that, all these other organizations are working on to try to expand these trails and, spaces for people to bike lanes. And then again, that's where that built environment comes in to enhance physical activity levels. And so these are all objectives that Healthy People 2020 have. And normally I would have y'all in class, choose some objectives and talk about how you would achieve this. But this is just some critical thinking that I want you to think about is how would you actually achieve if I had you pick these objectives? Like what would you do to make this happen in your community? Which is a really cool thing to think about. So that finishes up our lecture. With this topic, it's pretty important just to understand what opportunities that we have available to us, especially referring to the resources. And so if you ever need help with understanding more about physical activity guidelines, anything regarding nutrition, diseases, illnesses, or just becoming a healthier version of yourself, those resources, especially the World Health Organization, the CDC, the U.S. Department of Health and Human Services, if you qualify for Silver Sneakers, all of those options are out there and they're available for you to look at. And so I would take advantage of them because they have so many great resources, infographics, websites, link sheets for you to access. Okay. All right. That's it for today. We'll talk to you soon.